Every year, millions of people board international flights carrying something more valuable than their luggage. Hope. Hope that somewhere else, someone can save their life. They're not traveling for a holiday. They're not traveling for business. They're traveling for healthcare. Today, medical tourism has become one of the fastest growing industries in the world, generating well over $100 billion every year. By 2032, that figure is expected to exceed $346 billion. But that raises an important question. Why are millions of people willing to cross borders just to see a doctor? Shouldn't the best healthcare be available where they live? The answer lies in 3 problems that healthcare systems around the world continue to struggle with. But before we continue, if you enjoy business stories that go beyond the headlines, you're in the right place. Here at Africa Digest News, we don't just report what's happening, we decode how business works in Africa. If that's the kind of content you enjoy, take a second to like this video, subscribe, and tell us in the comments, which African business or industry should we decode next? Now, let's get into the story. Medical tourism wasn't built because people wanted to travel. It was built because they needed to. For years, patients traveled abroad because the treatment they needed simply wasn't available in their own countries. But over time, countries like India, Thailand, Singapore, Turkey, South Korea, and Malaysia invested heavily in modern hospitals, advanced medical technology, and internationally trained specialists. They didn't just improve healthcare, they created a global industry. And that industry solves 3 major problems.
The first is cost. Healthcare can be incredibly expensive. In some countries, a single operation can cost more than an average family earns in several years. For patients without comprehensive insurance, treatment can become financially devastating. Medical tourism offers another option. Patients compare hospitals across different countries and choose destinations where the same procedure is available at a much lower cost. The savings can be so significant that even after paying for flights, accommodation, and meals, they still spend far less than they would at home. The second problem is time. Finding the right doctor isn't always enough. You also need one who can see you soon enough. In many public healthcare systems, patients wait months or even years for non-emergency procedures. During that time, their condition may continue to worsen. Medical tourism offers another choice. Instead of waiting indefinitely, patients can travel to hospitals with shorter waiting times and receive treatment much sooner. Because in healthcare, time can change outcomes. The third problem is availability. Not every country has the specialists, equipment, or facilities needed for complex procedures. Whether it's advanced cancer care, heart surgery, organ transplants, or specialized fertility treatment, many patients simply don't have access close to home. For them, traveling abroad isn't about finding a better hospital. It's about finding one capable of performing the procedure at all. When treatment doesn't exist where you live, crossing a border becomes the only realistic option. Those 3 challenges, cost, time, and availability, have transformed healthcare into a global marketplace. According to the African Development Bank, Africans spend more than $1 billion every year seeking medical treatment outside the continent. That's more than $1 billion flowing into hospitals, airlines, hotels, transport providers, and healthcare businesses in other parts of the world. For years, countries like India became leading destinations because they offered specialized treatment at prices many African patients could afford. But that raises an important question. If Africans are already spending billions of dollars on healthcare abroad, why can't more of that care and more of that economic value stay within Africa? That's the opportunity, and it starts with understanding how medical tourism works. At its core, the process is surprisingly simple. A patient needs treatment. They find a hospital in another country offering the same procedure at a lower cost, with shorter waiting times, or with specialists unavailable at home.
They share their medical records, receive a treatment plan, travel for treatment, recover, and return home. For the patient, it's a single journey. For the economy, it's much more. Every medical traveler supports an entire network of businesses. Hospitals provide treatment. Airlines provide transport. Hotels provide accommodation. Restaurants, pharmacies, rehabilitation centers, transport companies, and medical companies all earn from that one patient. Medical tourism isn't just a healthcare industry, it's an economic ecosystem. That's why governments increasingly see it as an export industry. Instead of exporting products, they're exporting medical services. Instead of shipping goods overseas, they're attracting people to spend money within their borders. Healthcare becomes a source of jobs, investment, and foreign exchange. And few people have embraced that opportunity more boldly than Kenyan entrepreneur Julius Mwale. For decades, East Africans traveled abroad for specialized treatment. Mwale asked a different question. What if they didn't have to? That question became the foundation of Mwale Medical and Technology City in Butere, Kakamega County. The vision was ambitious. Build a healthcare destination capable of attracting patients from across Africa by combining medicine, technology, housing, and supporting infrastructure in one integrated development. Research conducted between 2007 and 2012 revealed what many already suspected. Thousands of East Africans were traveling overseas every year for specialized treatment, creating a market worth billions of dollars. Mwale believed that if Africa could build internationally competitive medical facilities, some of that spending could remain on the continent. At the heart of the project is Hampton's Hospital, designed to provide specialized services including cancer treatment, cardiovascular care, kidney treatment, orthopedic procedures, and other complex medical services. But the vision extends beyond the hospital itself. The goal is to create an environment where patients can receive treatment, recover comfortably, and access the services they need without leaving the country. Because the product isn't just healthcare, the product is the entire experience. And that's perhaps the biggest lesson from medical tourism. Successful businesses don't simply sell products. They solve problems people urgently need solved. Medical tourism succeeded because it combined four things: high quality, lower costs, convenience, and trust.
Customers don't always choose the cheapest option. They choose the option that offers the greatest value. A patient traveling thousands of kilometers isn't simply paying for surgery. They're paying for confidence, for access, for peace of mind. And that lesson applies far beyond healthcare. The biggest opportunities rarely come from creating new problems. They come from solving existing ones better than anyone else. Because when a problem is important enough, people won't just change brands. They'll cross borders, they'll cross continents, and they'll travel across the world to find the solution. If you enjoyed this documentary, give it a like and subscribe to Africa Digest News. Every week, we decode how business works in Africa, breaking down the companies, industries, and ideas shaping the continent's future. And if there's an African business or industry you'd like us to explore next, let us know in the comments. Until next time, this has been Africa Digest News.